Good day, everyone, and welcome to this class where we'll be talking about overall precautions in healthcare settings. Significance in healthcare. A clean healthcare environment minimizes the risk of healthcare associated infections. It is a fundamental barrier to the potential spread of infections among patients, healthcare workers, and visitors. We will be looking at the common surfaces that requires attention for cleaning in order to prevent bacteria or infections. 1. High-touch surfaces. Bed rails, bedside tables, door handles, light switches, and equipment tools. Due to their frequent contact, they pose a higher risk of disease transmission, and they should be cleaned thoroughly. 2. Floors and walls. Though they are less frequently touched, they can harbor pathogens, especially when visibly soiled. 3. Medical equipment. Stethoscopes, blood pressure cuffs, thermometers, and other reusable equipment that come in direct contact with patients. Now we'll be looking at the instructions on how to clean these surfaces and these furnitures to prevent infections. 1. Routine cleaning. Regularly clean surfaces, especially high-touched surfaces, even if they look clean. 2. Using the appropriate disinfectant. Choose a disinfectant known to be effective against the target pathogen and appropriate for the surface material. 3. Follow manufacturer instructions. This includes recommended contact time when the disinfectant needs to remain wet on the surface to be effective. 4. Ensure safety. Personal protective equipment is essential when handling disinfectants. Additionally, ensuring proper ventilation in the area is also crucial. 5. Meticulous technique. Clean from the least soiled to the most soiled areas. Replace cleaning clothes and mop heads frequently to avoid spreading dirt and pathogens. These methods or instruction is the first way to start preventing transmissions. Understanding standard precautions. In the ever-revolving realm of infection control, healthcare professionals employ one constant strategy: standard precautions. These practices are fundamental, ensuring that every patient receives care that maximizes therapeutic effects and minimizes the risk of infections. What are these precautions? They are a set of infection control practices used to prevent transmission of diseases that can be acquired by contact with blood, body fluids, non-intact skin including rashes, and mucous membranes. In summary, these are the main practices everyone must follow in order not to contract infections to the body. Key components of standard precautions. 1. Hand hygiene. It is crucial and very important to wash your hands thoroughly before and after coming into contact with patients, as well as after touching surfaces or objects that may be contaminated. 2. Use of personal protective equipment. Donning appropriate PPE such as gloves, gowns, mask, and eye protection depending on the anticipated exposure. 3. Respiratory hygiene or cough etiquette. To prevent the spread of germs, it is crucial to cover your mouth and nose when you cough or sneeze. You can do this by either using a tissue or coughing into the elbow. Applying standard precautions. We apply standard precautions to all patients, no matter their diagnosis or presumed infection status. Here are some examples of these precautions. Care of wounds or surgical sites. Insertion and care of intravascular lines or urinary catheters. Respiratory therapies in suctioning or intubation. Drawing blood or handling specimens. In understanding these precautions, healthcare providers arm themselves with a universal strategy to prevent the transmission of infections. It creates an environment where safety and care coalesce, ensuring patients and healthcare workers are protected from potential harm. Specific isolation precautions. While standard precautions are essential in every healthcare encounter, certain situations demand extra layers of protection. These instances where patients are suspected or confirmed to have specific diseases that can be easily transmitted. Here, we delve into the distinct types of isolation precautions tailored to prevent the spread of particular infections. We have three main types of isolation precautions. These are: 1. Airborne precautions. For diseases or pathogens like Mycobacterium tuberculosis, measles or rubella, varicella or chickenpox, and severe acute respiratory syndrome, among others. The PPE to be used should be 95 or higher level respirator. Room placement should be single patient rooms with negative air pressure with 6 to 12 air changes per hour. 2. Droplet precautions. The disease or pathogens are influenza, meningitis, and certain types of pneumonia, pertussis, which is whooping cough, mumps, etc. PPE should be used is surgical mask and eye protection if in close contact. 3. Vector precaution. Disease or pathogens here are multi-drug resistant organisms like MRSA, VRE, certain gastroenteric diseases like Clostridial difficile, respiratory syncytial virus (RSV), and scabies, among others. Room placement: private room or cohorting with patients with the same infection. Implementing isolation precautions. Early recognition of patients requiring isolation is vital. This can be achieved through proper history taking and initial assessment. Clearly marked signs should be placed outside the patient's room, indicating type of isolation precaution and the required PPE. 3. Both the healthcare team and the patient, including their family, need to be educated about the reasons for the precautions and the proper protocols. 4. The patient should stay in their room as much as possible. If movement or transfer is essential, ensure the patient uses appropriate barrier precautions. 5. Ideally, patients under isolation precautions should have dedicated medical equipment like stethoscopes, blood pressure cuffs. If shared, the equipment must be strongly disinfected. Note: isolation precautions are more than just barriers. They are a testament to the healthcare system's commitment to individualized care. By understanding and correctly implementing these protocols, healthcare providers can ensure the safety of patients, colleagues, and community as a whole. Steps for implementing isolation procedures. Step 1: Early identification and assessment. Begin with a comprehensive assessment of the patient to identify the potential or confirmed presence of infectious agents. So we have to be sure that the patient is actually infected. Then, utilize diagnostic tests and clinical manifestations to pinpoint the type of infection. Step 2: Determine the appropriate type of isolation. Based on the assessment, decide whether the patient requires airborne, droplets, contact precautions, or a combination of all of them. Step 3: Patient placement. Place patients in the appropriate room type, like single room and negative pressure room, depending on the type of isolation precaution. Ensure proper signage outside the room to indicate the type of isolation and necessary precautions. Step 4: Educate patients and visitors. Inform the patient about the reason for isolation and duration and what to expect. Educate visitors on proper hand hygiene, PPE usage, and any other specific measures they need to take. Enlightenment is very important in every case of health and hygiene. Step 5. Donning and doffing PPE. Healthcare workers should be trained to put on and take off PPE correctly. As we have learned donning and doffing PPE in our previous class. Step 6. Limit patient movement. Restrict the patient's movement outside the isolation area. If transfers are necessary, communicate the patient status to the receiving department and ensure precautions are maintained during transit. Step 7. Regularly monitor and review. Continuously evaluate the patient's condition. Decide on the continuation or discontinuation of the isolation based on clinical judgment and test results. Step 8. Maintain environmental cleanliness. Ensure regular cleaning and disinfection of the patient's environment. Handle waste materials properly, considering them as potentially infectious. Preventing transmission in healthcare settings. We are looking at the challenges and the solutions to these challenges. 1. Non-compliance or misunderstanding of isolation protocols. A lot of people fall into this challenge. They do not understand and therefore they do not obey. The solution is regular training sessions, audits and feedback mechanisms for healthcare staff. Educate patients and visitors effectively. 2. Resource constraints such as a shortage of isolation rooms for PPE. Solution: prioritize resources for the most critical cases. Employ temporary solutions like portable isolation units and strategize for effective resource management. 3. Psychological impact on isolated patients. Ensure regular communication, provide psychological support, and involve the patient in care decisions. Now, we will look at the measures taken to prevent transmission in healthcare settings. The first measures taken are proactive measures, building a fortified defense, routine and transmission based precautions. 1. Ensure regular hand washing and use of sanitizers. 2. Proper usage of gloves, masks, gowns, and shields. 3. Use tissues, elbows, or mask to cover the mouth and nose. Environmental controls. 1. Employ systems like HEPA filters to trap infectious particles. 2. Regular disinfection of surfaces with approved agents. Administrative controls. Limit visitor numbers and implement screening procedures. 2. Regular staff training and updated infection control protocols. The second measure taken is reactive measures in the face of an outbreak. Surveillance and monitoring. Swiftly detect any unusual infection increase within the facility. Isolation. Separate the infected or individuals that are suspected from healthy population. Contact tracing. Identify individuals who have been in contact with infected persons and monitor or test them. Review and update protocols. Assess the situation and refine strategies as necessary. The role of an individual. 1. Education and awareness. Understanding the why and how of infection control procedures. 2. Compliance. Adhering to established guidelines even when they seem cumbersome. 3. Feedback. Reporting potential issues or breaches in infection control measures. The fight against infectious agents within healthcare settings is ongoing. Success in this battle isn't just about extensive interventions, but also the small, everyday practices that become second nature. In this endeavor, everyone is a vital player. Together, With the collective efforts and diligence, we can significantly reduce the transmission of infections and ensure a safer healthcare environment for all. Thank you for joining this class, and I hope you learned something new. Do have a wonderful day ahead. Thank you.